this is just what I need right now. Another problem. So I'm just going to go ahead and let you know now. Your dentist is not here. He quit. He leave me with all his patients, and I have to go through all his notes, get all of these schedules back together, and try to learn all of this information in like 24 hours. And you show up. Please tell me you're just here for a cleaning. Of course you aren't. Okay, let's just hurry up and get this over with. Do you have your insurance card? I cannot help you without insurance card. I know your last dentist, he did not care if you have insurance or not. He just wants help. That is probably why we are the worst reviewed in the area. We only have 1 star on Yelp, but that's only because we've worked with people who do not have up-to-date insurance card, okay? But I trust you have insurance card, correct? Okay, I take it from you. Okay. So your insurance is almost expired, but I still be able to help you, okay? And what is it that you are needing done today? You can have this back. Oh, so he cleaned your teeth last week, and you just come back for a wisdom tooth removal. Is that what you all call it, the wisdom tooth? Yes. Okay. Yeah, in my country we do not call it wisdom tooth. We call it a problem child in the mouth, because it is just a problem, consistent problem in your mouth. Well, don't tell me I have to ask you 1,000,001 questions, so I do not want you to have to repeat yourself. So I'm going to ask you all of those questions, and then you answer, and then I help you out, okay? So after I already have your insurance information on file, and since you were here last week, we already have a file for you. Would you like to use your last method of payment? Okay, you have new method of payment. May I please have, please? Thank you. So I enter this new information, and we see if it processes first. People give us cash app cards with no cash on it. So we send half the payment to see if it'll authorize only half, then we do the other half when we are done, okay? Here you have your debit card back. Okay, so it looks like your card information was successful and we are able to go ahead with the procedure. Now, was there anything else that you feel like you need to give me? Okay, go ahead, give me that too. Thank you. So you have a coupon for 20% off of your procedure, and it was given to you by a friend. So I enter your discount information, and since you get 20% off, almost all of your procedure has already been covered. You just have to pay 30% of the 50% that we already take out, okay? Okay. Now I keep this and set this over here. So I only have to ask you a few more questions and then we go ahead with the procedure, okay? So between now and last week, has there been any changes in your general health? No. What about your oral health? Yes. Okay, so what is different besides the pain of your wisdom tooth? Okay. And what, well, I have that. I was going to ask you what was the date of your last oral examination, but I was assuming that is last week, correct? Okay, good, good. Do you have any allergies? Because we do not have any anesthesia. We use different methods to relax your body when we remove the wisdom tooth, okay? So do you have any allergies? Oh, you are allergic to grape. Okay, is it artificial grape or regular, like organic grape? Well, lucky you, you don't have to take nasty grape medicine. Okay, so I know that my attire is not very professional, but we have to do what we have to do around here. So what I do for you, I get your emergency contact just in case something goes wrong during procedure and we need to call and inform them of a possible death. That's just the bottom line. When you come here, that is the risk you take, but you may not be able to drive after we do this procedure because of the sedative that we give you. Yes. Can I have the name, please? And the last name? And may I please have their phone number? Okay. So we have all of that done for you, and I am also showing that you had an x-ray done. Okay. So we should have the results to that x-ray today, and I go ahead and I show you that. Then we go ahead and we pull your wisdom tooth for you, okay? So I have finished all the notes. You wait right here and I will have someone take you back to the I guess the dentist room, examination room. I don't know. All I know is the waiting room and the break room. That is all. So cross my finger everything goes well. I'll come back and we're going to be ready for your procedure, okay? Okay, give me 1 second. Okay, hello. Welcome to dentist chair. Are you feeling very relaxed? Here, let me recline you some more so I have better angle for inside of your mouth. Okay, so what I do for you now, I go ahead and review everything we do, show you the x-ray so we can have an idea of which wisdom tooth we pull. I know you know which tooth, but I'm not very familiar with your oral anatomy because you have a lot of teeth. I'm not trying to be mean, but that's just the truth. You have a lot of teeth, okay? So I'm going to go ahead and review everything for you. Now, for your sedatives, we have this sleep aid. Okay, so we did no grape. You see, no grape. We have strawberry, raspberry, and blueberry. No grape. It just look grape. We also have pill sleep aid. Okay, this does not make you go to sleep. This is sleep aid. It aids you to sleep, okay? So we give you one of these just to make you a little drowsy, and then we go ahead and put numbing gel around your gum so we can pull the tooth out, okay? So would you rather have the sleep aid syrup or the sleep aid gel? Yes, this is a gel capsule. Okay. We only give you 2. Okay, they're very tiny, like these. Here you go. You take those, and I will wait for you to swallow. You do not need water for these. You just swallow. And now for your numbing, I have these two puts. Oh, I cannot open. We have these two puts around the inside of your mouth. So if you open wide for me, I go ahead and get started with the procedure, the oral procedure, and I just paint this on the inside of your gum. I just do all of your gum because I'm still not sure which tooth it is that we're going to be pulling out. This is only first coat. Second coat will be more numb, but I let this numb up while I look for your x-ray, okay? Okay, so we have iPad now where we can check to see where exactly it is that we need to pull tooth from. I also have your past dental records in here, but right now the only thing we are really looking for is your x-ray. Okay, I believe these are yours. These look like they could be your x-ray, but I turned sideways just to be sure. Okay, so this is your x-ray. Now you see why I am so confused as to where exactly it is, which tooth we are pulling, because I really believe it is this tooth here, or on this side, this tooth over here. I'm not 100% sure, so I just put on gloves and put my finger in your mouth, and then we go ahead and we see if that is the tooth that actually hurts and is giving you a problem. Okay, please do not bite me. That is actually why I always stayed working in the waiting room, because I have a very big fear of someone biting me. And I know I cannot be talking about people's teeth, but you have some chompers. I cannot get over this x-ray. How do you do this? How do you do this? Yes, let's zoom in. This is your grill. This is your mouth. You only have one mouth. You need to take care of this mouth, okay? Look at this. You ought to be ashamed of yourself. Okay, this is what I do for you. I go ahead and I put on my gloves. The numbing cream should start working now, but I have one more layer. I put on my gloves and I get to work, okay? Because at this point, it really does not matter who works on your teeth. You don't care about your teeth, obviously, so why should we? Did you, I don't even know how to ask you this. Please do not think I'm trying to be funny when I ask. Did you, were you in the army? Were you in an accident? Did you, let a grenade explode inside of your mouth? Gosh. Never in my life have I ever seen an x-ray like this, but as you open your mouth and you talk to me, I see. Let me get, this is my bag of tools I use for you today, okay? Look, we even have an electric toothbrush for you, and it works. Already have battery, no excuse. Oh, I did not have time to go to the store and get. No, you have battery already in here. I'm just going to use that to brush the tooth off. But here is your other numbing gel right here. Open mouth, and I just insert that inside and put it all around your gums, just on the bottom part. And now we do the top part. Okay. And I apologize in advance if you hear other people talking. We have other procedure going on. Sometimes screaming, but nothing ever totally about. Okay. Now I start to work on the teeth. I take your brand new toothbrush here, and I go over ahead and I scrub the tooth, all teeth clean, okay? Please do not go, do not exhale, because your teeth smell like how they look. Horrible. Did you care to floss before you come here today? It look like you eat chicken strips. It smell like you have chitlin though. And you did not clean between your teeth. You just get a cleaning last week. So after I do this, I have to floss your teeth for you. You want to clean as good as possible so there is no room for infection. Okay, we are done with the scraping. Now I go get some floss, not floss that with two string in. That is disgusting. I never want to put both my hands in your mouth and manually clean. No, I have a pick for that. This here pick for you, like this in here. I take it and I pick everything out of your teeth. Oh, and now you're starting to breathe. I take clean cotton round and I place inside your mouth, okay? So we can clean all of the extra blood out, okay? Nothing too serious, nothing bad. You just get a little blood. Oh, you bleed a lot. Oh, this is not good. This is not good. You have only a little bleeding. It just come out a lot. It's only a little bit of blood, but it is coming out consistently. So I'm getting worried. Okay, you have blood inside mouth. It is bleeding uncontrollably, but I have something for that. I have this pad here. I don't know if you know what this is for, but it absorbs blood, okay? This is what they are for. They absorb blood. So I'm going to put this in your mouth until your teeth stop bleeding, because I still have to pull tooth, okay? Best time to pull tooth is when you are already in pain, because you're going to be in pain while I pull tooth, okay? So I give you this. You place that in your mouth. Let it absorb all the blood, okay? Okay, I go get everything I need to actually extract tooth out of the back of your mouth. I'll be right back, okay? Just hold pad inside mouth and let absorb the blood, okay? And if you start to feel dizzy, do not get up, do not move, because that make it worse. You may pass out, okay? 1 second, I come back and have something to make you feel better. Okay, so how do you feel now? Better? Okay, I go ahead and I add just one more layer of the numbing gel to your teeth. Good, good, good. And we go ahead and get this procedure started. Here I wipe little extra blood. Okay, so I have mirror here to feel which tooth it is. Okay, it is this tooth, is this I tap, okay? Here I have other two. I look with this and I tap with the other. No. Well, you'd have a lot of teeth. I'm having trouble finding this tooth here. Let me get a look at it. Yes, okay. This tooth is actually turning a dark color. So we have to get this out of here today. Okay. No problem, no worry, we go ahead and get out. So I use this to scrape around the gum until tooth gets loose. Then I take my finger and wiggle really hard, okay? And I pull out. Okay? Okay. It keep getting stuck. I feel like this is just me thinking. I feel like maybe you should not just get wisdom tooth removal, but all these extra teeth have those removed too. Please don't bite me. I was just giving a suggestion. Okay, we have tooth very loose now, so I take and I wiggle and I pull out. Okay, let's tap. How does that feel? Okay. So now I take and I wiggle. You hear how loose your teeth are now, and it is almost turning a dark color. I have tooth out. Now your tooth was purple with a hole in it. You need to take better care of your teeth, okay? But now that is all over, here we cannot close the hole, so all I can do is give you back this and tell you to hold it in your mouth. Do not move, okay? Just hold it inside of your mouth. Here, let me put you back upright, okay? Now, the best part, we want to ensure your service. We want to make sure that you always come back. So we have things to choose from. For candy, we have these bro pop here. But since you are such a good patient for me, we give you big candy. You can have a giant box of nerds, but you don't like grape, huh? I thought so. Okay. So instead of that, we have giant box of warheads for you. You don't like the sour candy? Okay, that's no problem. But lastly, this is the last thing we have. We have a giant gummy watermelon. Do you like watermelon? I know you do not like grape, but what about the watermelon? Yes. Okay, we give you this. And since you already signed in with me, you do not have to sign out. I just let you lay here and rest until you feel not lightheaded and you go and you drive home. But if you feel like you need me to call your emergency contact to come get you, please let me know in the next 30 minutes, because I'm not kicking you out and telling you you have to go home, but you cannot stay here, okay? Okay, but I do the best I can for you. Please come back and let me know how you feel. Matter of fact, I go ahead and I schedule you for a follow-up visit, okay? I schedule it here on the iPad, so we don't have to go all the way back up to the front. Okay, so we schedule you a follow-up visit 2 weeks from now. But if you feel like you need to go, then to the hospital, go to the hospital. Do not call. You call the 911. Do not call me or this office, okay? Because we will not answer late at night, okay? Well, I see you next time. I have you scheduled and it should send to your email, okay? Yes, and we charge the 30% off of your card, okay? Alright, now we leave you here to take a nap. Bye bye.